about the importance of using pre-surgical aesthetic planning for your dental bridges. As we know, in extensive rehabilitation, such as the one that you are seeing on the screen, we must start with the prosthetic portion to then use that prosthesis to help us, to guide us on the implant position, and then perform the actual surgery and prosthetic part of the treatment. So looking at this case over here, done by Dr. Adrian Granella from Argentina, a Smilefy member, notice here that we have the patient's digital files, which are the patient's facial photograph, as well as the upper and lower intraoral scan. Okay, so when you get the intraoral scan, make sure that you also have a bite registration already with the interocclusal space that will allow you to have the proper space to design it into the software. So after designing the case, and we will go over that in a couple of seconds, you can export the case and send it to your implant bridge planning, which will then help you to better position the implant based on the dental bridge that you created in Smilefy. With all these files together, you can send it to your lab and they can manufacture the immediate loading dental bridge or the temporary dental bridge, the transitional dental bridge, or even the permanent dental bridge for your patient. So to make it clear in here, the pre-surgical digital aesthetic planning on Smilefy is not the final dental bridge design, but is the stage. It's part of the stage of your pre-surgical treatment plan, which gives you a higher standard on the dental processes that you are going to deliver to your patient. Moreover, the pre-surgical static planning is very important so that your patient can collaborate better on the case itself, giving them the chance to help you with the selection of the teeth shape, with the pink aesthetics, which means like either showing more artificial gum or not, and for you to check on a better balanced smile in comparison with the patient's face. So the process can be very quick as long as you follow the steps that we have created here in the software. So the first step is to superimpose the patient's picture and with the intraoral scan. So look over here that we have the patient as kind of like a base for the dental bridge, and then we have the intraoral scan that goes over the patient's existing teeth in the photo. Then the second stage is to preset the curvature of the patient's smile, as well as the proportions and midline according to the patient's face by using what we call a smile frame. So this is smile frame here that you see are these horizontal and vertical lines, and they can be adjusted by using the height, ratio, and midline sliders that you can see here on the right side. And then we have here a teeth chart that will allow you to add as many teeth units as you would like. As a standard, I preset it here from a first premolar to first premolar. And by going to the next step, you already begin to evaluate the future implant bridge design. So look that you have 4 different views. These are all the same dental bridge design, the same case, but from different angles, which facilitates your planning. Let's say if you want to bring the central incisors more buccal or more lingual, you can simply use the commands that you see here on the screen to make the proper adjustments, such as bringing it to one side to the other, rotating or adjust the cant of that smile. In this specific case, the patient is starting with the upper design, so that's why you don't see the lower, but you can also design the lowers if that's a case that you have in your practice. But beginning here with the upper, I already preset the occlusal plane. Notice here that it needs to be rechecked later with the dental technician in his own lab software, but for us as dental clinicians, it already gives us a better understanding on the aesthetics and the proportions of the design as we are studying and making the analysis here. Over here on the top, we have several workflows, not only the implant bridge design, but let's focus here today on the implant bridge design, and you can follow the steps that you see here on the top. So if we go over the templates, for example, over here on the right side, we have several teeth templates. They can all be exported later to your dental lab for them to manufacture even the final bridge designs or to make any modifications that you started in the Smilefy software. So by clicking on the teeth template, it automatically appears in the patient's mouth as well as on the other options that you see here from these other views. And if you have your patient chair side or if you have your patient next to you, you can already show the patient different teeth designs. If I go over here, for example, I can simulate the smile in the patient's mouth. So notice over here on the top left corner, just change here the screen for you to see on the full screen. We have here dental bridge done in a couple of minutes that can be pre-evaluated by your patient and pre-evaluated by yourself as a dental clinician with your clinical eyes. Talking about the clinical evaluation, let's go over here into smile analysis, and this is a very important step of your pre-surgical planning session of your dental bridge because it lets you understand the patient's facial characteristics to then deliver a more harmonious smile design to your final outcome. So if I click over here in facial analysis, for example, I see that an automatic horizontal line, which is represented by the interpupillary line, appears, as well as a commissural line. And these lines helps you to define if the central incisors are parallel to those horizontal lines, as well as if the cant of the smile is present or if you should correct it. Another feature that you can find here is the facial and dental midline. Although we tend to focus too much with the dental midline going exactly on the cupid bowl and not looking at anything else, in prosthodontic steps, we must understand the patient's facial characteristics as well, and then follow that midline according to the patient's facial midline as well. Right? So then all these features can be done in here in this pre-surgical stage. Another feature is to add the measurement. Let's say that you are designing, but you don't know what are the height, what are the proportions of the design that you are creating. Let's say that sometimes you need to add a little bit more length, but you don't want to go over the standards of teeth proportions. You can simply click here in measurement and then make the measurements. Check on those height and width to make sure that you are not creating very long or very short teeth designs for your patient. This is all done in the pre-surgical stage, and again, it's to facilitate and cut the time between you and your dental technician. Following the workflow, let's add now a gingiva to this dental bridge. Of course, some implant bridge designs are only dental supported, right? There's no gum in it. Let's add an artificial gum into the dental bridge design, and as you can see, it automatically appears on top here on the cervical margin of the patient's existing teeth. So let me go back here to the 4 views. You can make any changes here in the artificial gingiva, such as making it more narrow or making it more bulky, let's say, if you want to do it like that on the palatal area, depending on the implant placement planning that you are proposing. As well as to just make small adjustments in the gingival embrasures if that's the case. So now that you have created the dental bridge, you can export the files. And when you export the files, you will be receiving a dental bridge just like the one that you are seeing here on the screen, which becomes crucial for your surgical implant planning, as well as for your dental technician to finalize the dental bridge according to your pre-surgical aesthetic planning. But not only this file, a full set of digital files so that your lab can use in case he needs to reuse some of the teeth templates, or if he wants to reshape the gum or make any adjustments, or even if he wants to add the teeth templates that you exported from Smilefy into his own lab software to manufacture the finals, he will be able to do so, as we export all files here as an STL file. By finishing your pre-surgical dental bridge design, you then send the file to any implant planning software, as long as this software can allow STL files. The doctor used the 3-shape surgical planning, and by superimposing these files, he was able to also add the CT scan and then treatment plan the position of the implants based on the design that he created in the Smile software, facilitating then the procedure and the steps to deliver a more harmonious and clean surgical execution of the treatment. Now that the doctor has the pre-surgical static planning of the treatment, as you can see, the implant planning becomes much easier because you have already the processes based on your clinical findings and based on your pre-treatment planning. And the dental technician has now valuable information to manufacture the immediate loading dental bridge or the intermediate dental bridge for you to perform in the patient's mouth. This case specifically was an immediate loading dental bridge. And as you can see, the design looks pretty much the same as the design that was created on Smilefy, because the doctor really focused on the aesthetics of it. And we know that for the patient, although function is an essential part of the processes, the aesthetics is what makes the patient very satisfied with the final result, along with the functions. For you dentists who perform these type of procedures, I highly recommend you to deliver these pre-surgical digital aesthetic planning into your practice so that you can have higher predictability on your final outcomes and communicate better with your patient and your dental technician to ultimately deliver a satisfying dental treatments to your patient. For more information on how to become a Smilefy member, please contact our integration consultants at +1 786 713 1168 or email us at info@smilefy.com, and we will be able to go over your main goals and help you to implement this workflow in a dental practice.